In some breaking news, there have been 10 more deaths.
The death toll from the outbreak of coronavirus in Italy has surged.
The deadly coronavirus has overwhelmed hospitals and mortuaries in some of the most developed economies across the world. A reminder of the devastation a flu virus could have on Uganda's health system. Once COVID-19 was declared on the African continent, it was a warning to Uganda.
It is wise that we temporarily remove these concentration points by closing all the primary and secondary schools.
A matter of when, not if.
Uganda has confirmed her first case of coronavirus disease.
The government has decided to keep the stay-home decision for another 21 days.
A nation at war. A war against an invisible enemy. An enemy that must be defeated squarely.
Government has strengthened the COVID-19 pandemic response by beefing up the Ministry of Health teams with specialist doctors from the Uganda People's Defence Forces Directorate of Medical Services.
So the N95 mask, it's kind of like a cap. It's got these two strings, okay? And then it has got this metallic band at the top. We see that. So to put on this, you hold it like cap facing up and put your hand through. Are we together? Then you press that onto your face.
This was on the 18th of March 2020, 4 days before Uganda registered its first case of coronavirus. There are at least 86 medical officers here undergoing training on COVID-19 in preparation for war. War against an invisible enemy, a virus that the world knew little or nothing about.
We saw this coming when we had the first case in Egypt. We said now the African continent was affected. So we requested to be trained, and we trained 86 medical workers, both at Timbuya and Pombo.
The UPDF has been receiving training from partner agencies, the Ministry of Health and World Health Organization, as far back as 7th March 2020, when the first cases of COVID-19 began spreading in the African continent.
As you know, support to civil authority in emergency situations is one of our core functions as UPDF.
We also sensitized UPDF leadership using the same team of WHO and the Mulago Hospital.
This matter came at a time and in a form we least expected. So we have managed, and it's been a learning curve for us as UPDF and across government. But we've learned on our feet because it's a novel threat.
This medical training and timely intervention under the Commander-in-Chief, retired General Yoweri Kaguta Museveni, would later form the core of Uganda's commendable fight against COVID-19.
82 UPDF medical personnel of different categories are supporting the response in various fields of case management, surveillance, logistics, etc.
On the 25th of March, 250 medical personnel from the armed forces, the UPDF, police and Uganda prisons were deployed in various health centers across the country following a request from the Ministry of Health for backup. Colonel Dr. John Lusiva, who is the team leader case management of COVID-19, says the greatest achievement was for the People's Army to step in at a time when the country needed them most.
We came day one, we started screening. Remember, there were so many people from Dubai and other places that had contacts. So Mulago was flooded with people. So our first job was to screen. So we went down, The Mulago teams were also boosted by our lab teams. So they went on swabbing people. So we kind of made their work a little easier in terms of numbers and capacity.
In order to nip the virus in the bud and encircle it like an offensive against the enemy, the UPDF support team, comprised of personnel with diverse skills from land forces, air forces, and from the Special Forces Command, SFC, as Colonel Dr. Lusiba explains.
So when we came here, we were composed of 3 groups, Infection Prevention and Control, IPC group, a group for surveillance, and then for us, the case management, the team which I lead. So there's the surveillance teams, of course, went ahead in quarantine centers. And then for us, we came here to treat COVID. So in our team, we have people who are fumigators, we call hygienists. As you come in, all our surfaces are cleaned. All those are UPDF staff working here. We chose our medics from different components and dispositions and services.
The UPDF Chief of Medical Services, Major General Dr. Ambrose Musinguzi, dispatched the following personnel to Mulago National Specialized Hospital. 2 critical care specialists, 1 physician and cardiologist, 5 medical officers, 6 hygienists, 7 nurses, 1 microbiologist.
When clients come, they are recorded in the book in the first station. Then they go in for swabbing, that is taking off the sample. Then from there, if the client has symptoms like cough, flu, sore throat, then we allow that patient to stay until the results come. Of course, they communicate before even the results reach us that we have positive number this, we have negative number this. We prepare for that case when he either is going to be admitted here in Mulago or taken to any other hospital.
As a UPDF personnel, it gives me joy to see that I'm on the front line, also working together with other colleagues to see that we are COVID-19 free.
Indeed, because of the joint hard work of the nurses and doctors, all of the initial 23 patients admitted at Mulago National Specialized Hospital were discharged within 1 month. A feat the Deputy Executive Director, Dr. Rose Byanyima, attributes to the concerted effort of medical personnel from the UPDF, Mulago Hospital, and specialists from Makerere University.
There was a need to have UPDF in Mulago to reinforce our own team. Yes, we already had 4 physicians from Mulago and Makerere College of Health Sciences, and were joined by 2 specialists from UPDF. And of course, definitely that improves the efficiency. Of course, when you have a team, you have many team players with different strengths. Secondly, we increased on the numbers of the team players. Not only the specialists in internal medicine, but also the nurses, the laboratorians, and all other support staff. So that increased the efficiency of the team.
At the national level, the UPDF deployed its officers to the Ministry of Health to perform critical tasks such as finding and isolating all cases, supporting logistics, planning, and providing management support to quarantine centers. The UPDF Director of Medical Services, Brigadier General Stephen Kusasira, heads the UPDF team at the Ministry of Health. Key among these is the COVID-19 Incident Commander, Lieutenant Colonel Dr. Henry Chobe, who has vast experience in treating and handling infectious diseases like Ebola in Uganda and West Africa.
I think it's a continuation of what we've always been doing, to always work with the civilians, and not only here, but all the places we have been and all the operations that we've been undertaking. Not only here, but I think the biggest thing here is that we've been able to work with each and almost every sector of the response, be it healthcare, be it logistics, be it sample testing, be it in border control, So UPDF is actually there. So to us, it's a good thing. One is that we work very well with our civilian colleagues, and also for them working with us.
Prior to the deployment of medical personnel at hospitals and quarantine centers across the country, the UPDF, with the support of USA, set up a fully equipped emergency hospital in Bombo as a possible isolation center.
The other day I was in Bombo to look at the emergency hospital that has been put in place, which we have had in our rapid deployment center in Jinja, but which we have now deployed as a possible isolation center to manage whatever case may arise within our ranks. It is in Bombo, it is state of the art. It's also available for the public if there is need to isolate some people, because at the end of the day we are also a backup to the civil health infrastructure.
With the rising number of cases in neighboring countries at the time, President Yoweri Museveni ordered a phased lockdown, beginning with temporary closure of schools and suspension of public transport. The COVID-19 presidential directives were and are strictly being enforced by the police and the UPDF. Once the president had ordered a countrywide lockdown to contain the spread of COVID-19, the National Security Council Organizing Subcommittee on COVID-19 created an interagency anti-COVID-19 joint task force on the 24th of March to coordinate the regional task forces and the National Security Subcommittee efforts.
It is mandated to monitor enforcement of compliance with His Excellency the President's directives and the Ministry of Health laid down anti-COVID infection prevention and control measures.
The Interagency Task Force has representation from 7 agencies, namely Uganda Revenue Authority, Directorate of Citizenship and Immigration Control, the Internal and External Security Organizations, ISO and ESO, police, prisons, and the UPDF, with its overall focal person being Lieutenant General Wilson Mbadi, the UPDF Deputy Chief of Defense Forces.
This was a very good arrangement. One, we have been able to realize that there are a lot of synergies that we otherwise were not able to achieve, but we've been able to achieve because of this jointness. We've also found the different potentials. For instance, when it comes to dealing with the truck drivers, we found that the Uganda Revenue Authority had a facility that is able to monitor the trucks. So out of that, we're also able to monitor the truck drivers.
A critical outcome of the enforcement measures was the mounting of roadblocks along highways and in town suburbs to ensure that only essential workers and emergency or security vehicles are allowed on the road as per the President's directive.
Since the commencement of COVID-19 operations, military police has been deployed on all the major routes that are accessing the capital city. We have a number of checkpoints. We have on Jinja Road, we have on Gayaza, Kayunga, we have on Hoima Road, we have on Bombo Road, we have on Masaka Road, we have on Mubende Road, we have on Entebbe Road. So there are a number of checkpoints that we are manning in order to support police. We have also a number of other activities we are doing. We are doing motorized patrols during the day and night. During the day, we're also doing snap checkpoints. We mount a checkpoint for a few hours, then we move to another area. We also mount. We are supporting police in case of those rowdy drivers who want to beat our checkpoints and who are not cooperating. We enforce police. We do night patrols where we have had a lot of achievements. We have moved in most of the areas of Kawempe, Tindabukoto, Busega, and we've been able to arrest a number of people Those ones found in bars drinking. And you remember the first restrictions were closing down bars and churches.
The second critical role of the Interagency Joint Security Task Force is to ensure that citizens strictly observe the dawn-to-dusk curfew as guided by the President on the concept of total silence so as to expose the enemy. A final briefing is given to these military officers before they embark on the night patrol. Military police and local defense forces have been particularly handy in this operation. However, the enforcement of these directives did not come without challenges. While majority of Ugandans observed the curfew, some obstinate ones went about their work in total disregard of the social distancing guidelines that were issued by the Ministry of Health. In such instances, the military police sensitized them on the danger of such obstinance. Others dared to provoke enforcement officers. For example, in April, Private Alex Niwanyine lost his eye as a group of locals pounced on him as he enforced curfew guidelines in Bibia, Amuru district, an act that President Yoweri Museveni strongly condemned. Niwanyine was later airlifted to Bombo Hospital for specialized treatment.
One of our soldiers lost an eye in the north. I went to see him. People pelting stones at patrols. So these are some of the occupational hazards we've had to face during this time.
As the biting 21-day lockdown entered its second week, concerns of lack of food were loud since people could not go to work. The Commander-in-Chief, President Yoweri Museveni, directed the Office of the Prime Minister to procure food for the most vulnerable communities in the country, especially in Kampala and surrounding areas. Again, the UPDF was at the forefront of ensuring proper food distribution in informal settlements or slums in Kawempe, Kamocha, Namuongo, Kisenyi, Katanga, amongst others.
Overall, the LDUs have also done a commendable job. You remember when they were introduced in the midst of heightened crime, especially in the KMP area. The wisdom of the president was that there was need for a fast call because the population had become vulnerable. And we needed some quick organic response within the community. And I want to say that largely they have done good in the purpose for which they were introduced. When it comes to COVID, we have used them extensively. And they've done well. All these patrols you see, all these checkpoints you see, many of them are manned by LDUs, and they've done well. The food distribution is done by the LDUs, and the mistakes of the few shouldn't be used to dent the good image of the LDUs, who are part and parcel of the UPDF.
The UPDF remained enforcing its core mandate of blocking illegal movement across the border. With even greater force, considering that the COVID-19 virus from across the borders presented an existential threat. The UPDF deployed along the 51 border districts, particularly along porous border points. The army had a presence from Busime landing site to Majanji on Lake Victoria. They were also along the River Sio swamps that of recent had become spots for human traffickers working with local authorities, all the way to Lake Albert in western Uganda. the UPDF destroyed boats used to smuggle people across the border in areas of Sigomere, in Majanji, and also impounded and chained several transport boats. More deployments were done in Buhehe sub-county in areas of Buyinde and Buyandeti. Similar deployments are in Buyengo, Busumba and Nangwe, in Dabani sub-county in Busia district. The Chief of Defense Forces, General David Muhoozi, says the deployment greatly reduced illegal movement across the border, with the violators arrested and quarantined for the mandatory 14 days.
I think we need to mobilize the population to do the job and to raise the red flag when somebody comes in irregularly.
While the country was still coming to terms with the coronavirus pandemic, an unprecedented huge floating water weed washed up almost into the turbines at Jinja, disrupting electricity generation at the Owen Falls Dam, effectively throwing the entire country into a nationwide blackout. This made thousands of people miss the president's popular address on tackling COVID-19 on that day. Shortly after, President Museveni and the Chief of Defense Forces, General David Muhoozi, inspected the Nalubale and Bujagali power plants to assess the extent of the damage. The UPDF was then called in to lend a hand in ending the blackout. Yet again, the UPDF stepped up to the occasion and showed discipline. Together with other agencies, the UPDF's engineering brigade worked tirelessly to clear the disruptive floating island and restore normalcy.
We are here today to remove the floating sand, which is approximately 4 acres and 4 meters deep, which came from the direction of Masese and is blocking the dam. We are using excavators.
Amidst all the ongoing battles with the invisible virus, an even bigger war was raging in eastern Uganda when a large swarm of locusts was wreaking havoc. This was the second time that it was returning in a few months. A section of UPDF soldiers led by Deputy Commander Land Forces Major General Sam Kavuma was dispatched to tackle this growing problem and a threat to food security.
The first swarm of locusts entered Uganda on the 9th of February.
The locusts had now spread to 4 sub-regions of the country.
The main one being Karamoja sub-region. They have invaded all the 8 districts of Karamoja sub-region. Then from there they have also been to Teso sub-region in about 4 districts. Then from there you talk of Acholi. They have been in 3 districts of Acholi. That is Kitgum, Ramo, Agago and Padere. 4 districts of Kitgum. And then Lango. They have been in 1 district called Otuke in Lango. I've been there about 3 times. Now, the UPDF was deployed there to support Ministry of Agriculture. Locusts are quite very challenging insects because they come in huge numbers. The science will tell you that a real swarm of locusts is between 40 million to 150 million locusts. And of course we know how much they eat. For example, they say a locust eats food equivalent to its size.
They would have caused greater damage had it not been for the joint intervention of the UPDF, the Ministries of Agriculture and Disaster Preparedness, amongst others.
So they were supposed to have eaten all the crops in all those sub-regions and food crops and trees and whatever they landed on. But they did not achieve that because, again, of our aggressiveness.
For an army largely known for physical combat, COVID-19 presented an opportunity for the rank and file of the UPDF to care for Ugandans in another manner at a critical time of need.
We have defeated 3 concurrent
big crisis. There's this one of the corona we are talking about, this water of the lake. So this water could have been a problem. Then the locusts. The locusts have caused so much mayhem in parts of Africa. They come here. We wait for the small plane of the desert. The locust doesn't come. The army moves in. And we defeat the locusts.
The Chief of Defense Forces attributes the UPDF's success in all these interventions to its strong history and culture of discipline and adaptability.
Culture of discipline is historic. Our discipline is built on two pillars. One, understanding our role and function, and that we call conscious discipline. And we instill this through training, including political education. Our ideology as a people's army. That one is one aspect that builds our conscious discipline. That failing, we have the mechanical discipline. That if you qualify yourself as a candidate for penal discipline or for punishment, and you have committed crime, then the service courts come into play.
In instances where officers failed or faltered in their mandate, they were taken to court and the law took its due course.
When you cross some threshold, then you are eligible for the service courts and for whatever punishment that the courts will pronounce. So that is part of our psyche, it's part of our DNA, to remain disciplined at all times, because that is what our calling demands. So I want to salute the rank and file of the UPDF for what they have done in all these challenges and for doing it well, regardless of a few mistakes here and there initially, which were corrected through a number of interventions.
The UPDF did all this while maintaining its core mandate of protecting the country both internally and externally, living up to its nomenclature as the People's Army and a force for good.